Very happy today to be interviewing Dr. Patrick Quaid. He's a best-selling author, speaker, researcher, and optometrist. He's based in Guelph, Ontario at the View Cubed Vision Therapy Clinics. They also have a clinic in North York, Ontario as well. Welcome, Dr. Quaid.
Thanks for having me.
Dr. Quaid, you've done a lot of writing, and you've been someone who's contributed both in scholarly articles and in other books. I'm thinking particularly of Dr. Komer's best-selling book, New Hope for Concussions TBI and PTSD, which is telling the story of the therapies that they use, and you're one of the contributors to that. That's an important chapter, as Dr. Komer has described it many times. Tell us a little about that and the other things that you contributed in other places.
Yeah, I think the chapter that we put in Dr. Comer's book, I mean, he was kind enough to reach out and say, I really think that your topic's important to put in here as a separate chapter. So I was very thankful to him for doing that. And his book is fantastic. It really gives a nice overview for the concussion patient. But I think what we've also realized over the years was about half of our pediatric learning difficulty group don't actually have any developmental risk factors. They weren't born early. They weren't preemie by 3 weeks or more. They weren't low birth weight. So there's nothing really in the birth history that you go, So we found that an approximate number is about 50% of our pediatric cases we think are actually not learning difficulty cases, but actually pediatric concussion cases being misdiagnosed as learning disorders. So when you look in the history, often the parents will say, oh yeah, when my kid was 3, they fell down some steps and they had a goose egg. So you hear that all the time. So I think that it's kind of like your two Venn diagrams where there's a ton of overlap. Mm-hmm. You have some pediatric learning difficulty cases are genuinely learning difficulty cases, but usually in the case history, there's, the kid was born early, they were low birth weight, they had supplementary oxygen at birth and things like that. There's something very clear in the birth history that will spell that out. And of course, Dr. Komer, by profession, is an OBGYN. So it's kind of interesting when we had that conversation and when he realized that the 3 biggest developmental risk factors for eye teaming disorders were actually rooted in his original area of medicine. And yet he'd never heard of them. And he said, the OBGYNs are not being told this. So the chapter in Dr. Comer's book was really neat to do. And of course, we did that before we did the book. So it was kind of like a test run. But I think the other thing that we did was a book chapter in a medical textbook. So there's a medical textbook that came out last January, so January 2020. And it's called Neuro-Sensory Disorders in Mild Traumatic Brain Injury or in Concussion. And Dr. Singman, so a shout out to Dr. Singman. So he's an MD PhD. He's the chief of neuro-ophthalmology at Johns Hopkins. They asked him to write the book chapter on eye teaming disorders in concussion, and he was humble enough to pick up the phone and call me and say, hey, let's do it, you from the optometric side and me from the medical side. So it was really nice to have that 1-2 punch because we both have our PhDs in vision science. So it was a really nice book chapter to have embedded in a medical textbook. So that was kind of fun to do. But I think, when I go back to Dr. Comer's book, what I really like about his book is the personal angle in that book, because as human beings, we're story-driven animals, right? We like to hear stories. And when you embed a concept in a story that also has an emotional connection to it, because there's not much more things that are more emotional than our children. I think that's when you really grab the reader's attention. And that's the type of book that you read 3 or 4 chapters and you've gone through 1 coffee and you're just glued to the book. That's the type of book that everybody likes to read. So I think it was humbling to be asked by Dr. Komer and also to be asked by Dr. Singman. But I think one feature that we all share in common is that we tend to have a humility trait where we're always trying to learn more. We never assume that we know everything. And there's not a day goes by in clinic that I don't learn something from a patient. I mean, my opening statement to most of my patients, as soon as they walk in the room, is something along the lines of, hey, there's a wonderful new concept in healthcare called talking to your patients. Have a seat. And that usually puts the patient at ease because they're like, oh, okay, this doctor's not just going to jump into doing testing. They're actually going to take the time to figure out what's going on with me. And not assume that, that the symptoms are, well, there's nothing wrong with you, therefore you can't possibly have a problem. I mean, as the saying goes, the worst thing that you can say to a concussion patient is you look fine, because concussion is a hidden injury, right? So, it was fun being invited to contribute to other books, and I think that kind of set me up for success with this book. But it's nice to be in a community of other people who've taken the plunge to write a book, because I think being articulate is one thing, but being able to write is something very, very different. And if you get somebody who's got good concepts and is reasonably articulate but can write, you've got a killer combination there. So I think people who have the ability to think outside the box and figure out solutions for patients, they almost have an obligation to write. And I think that's what I see in Dr. Singman and in Dr. Komer, is that they're prolific writers, they're prolific clinicians. They really pay attention and observe what goes on in their clinics, and I applaud them for doing that.
We were speaking to Dr. Patrick Quaid. He is the founder and CEO of the ViewCubed Vision Therapy Clinics in Guelph and North York, Ontario. The book is available on Kindle, Amazon, and also on Audible. So if you haven't got a copy yet or heard a copy, you can get them there. Thanks so much for your interview today, Dr. Quaid.
Thanks for having me.